So I wanted to start off talking about two cases in the hospital that I had encountered in the last few years. So one situation was a patient, a lady that came to my clinic. She said she'd been having chest pains, and these chest pains haven't happened from time to time, and they've been bothering her. They're kind of getting worse. And she's seen, at that point, she said she had seen about 2 or 3 different physicians for this particular chest pain. And each time she sees them, she tells them about the chest pain, and then they turn around and they say to her, it's all in your head, right? It's all in your head. I mean, Dr. Agarwal, I'm sure you can attest to that. This is not, we see this, believe it or not, it does happen. It's all in your head. And of course, I decided, okay, I talked to her, listened to what she had to say. We said, let's do a stress test. Stress test was positive. We said, let's go and do an angiogram. And lo and behold, she did have a blockage. And she ended up getting a stent. And she felt better. Her chest pain went away after that, right? But it's all in your head. We hear it all the time from women, either because they're too young, either because maybe the way they're describing the chest pain is not what the physician expects that the chest pain would be, and also because of all the myths we've had before that say that women don't have heart disease as much as men, and women, their symptoms are kind of different from men, and all these things that we've heard about before. People don't pay attention as much to women as they should. Another situation was the situation of this young kid that was in the hospital. I was on call. This was when I was training at University of Chicago. I was on call on a Saturday. Everybody knows things don't happen much on Saturdays in the hospital for the most part. But they called me from the pediatric part of the hospital, and they said, we've got this 16-year-old kid. He's having chest pains. We think it's just inflammation that he has. But, you know, we're not used to dealing with kids with chest pain, so do you mind coming to see this patient? And I had a lot of work to do on the adult side that day, but I said, you know, okay, I'm just going to go over quickly and see this kid and see what happens, and I'll come back. And it's kind of far. It's a different part of the hospital. It's actually a different building altogether. So I ran all the way over there, got there, talked to this kid, and I said, this kid is having a heart attack. I looked at his EKG. He's 16 years old, but he is having a heart attack. And boy, who's going to believe me? Nobody, right? I was a trainee then, so I called my attending physician, and I said, this kid is having a heart attack. I said, 16-year-old? No way, right? They said, okay, let's do a quick echo, which is a heart ultrasound, to see what we see. And we called the pediatric people because we couldn't go to the adult side to get it. It was going to be kind of cumbersome navigating the machine. We called the pediatric people. They did an echo, and they said, oh, we don't see anything. I said, I see echoes all the time. I'm training in this. It is a heart attack. After arguing for like an hour, and of course, time is hard, right? Because the longer you wait, the more the heart progresses with a heart attack. After arguing for like an hour with my attending, with the pediatric attending, with a whole bunch of other people, and fighting, he eventually made it to the cath lab. And you know what they call the widowmaker? That was where he was having his heart attack, the widowmaker. A 16-year-old kid, a 16-year-old kid. What were his risk factors for the heart attack that he was having? He was obese. He was a big kid. That was the main thing. I mean, he smoked cigarettes, but it wasn't, I mean, he's 16. He just started smoking like a couple of years before. That's not the reason. But the fact that he was big, and maybe he had a history in his family. He said nothing, he doesn't know of any history in his family, but it was just a strange situation. So I think the reason why I bring up these two cases is just to point out the fact that, number one, as a woman, yes, women do have chest pains just like men do. Women do have heart attacks just like men do. Women have heart disease risk factors just like men do. And people just need to take women a little bit more seriously when they're complaining, because they also have everything else, strokes and the rest of them that's associated with heart disease and death in women. So it's very important that people focus on that. And number two is not to ever underestimate the impact that things like diet and obesity or being overweight and the rest of them have on our health, no matter how young the person is. There have been studies out there that have looked at arteries in kids, little kids, that they found that they do have streaks of cholesterol plaques in their arteries. It just gets more and more as they get older, but they do have it. So at that point, they're still at risk for having a heart attack. So that's very, very important. So I wanted to kind of discuss a few things from this pamphlet, and then we'll share it with all of you so you can look at them. So in terms of managing your health conditions, who knows what your cholesterol level should be usually? Anybody know? So that's the general idea, less than 200. But I want to say two things. Number one is, it's really a matter of what your bad cholesterol is relative to what your good cholesterol is, right? That's what's important. You want your good cholesterol to be as high as possible. In women, we say it should be over 55 in women and over 45 in men. What brings up your good cholesterol? Exercise. Exercise. The more you exercise, the more you can get up. Now, there's a genetic component to it, so some people have to exercise more to get it up, but the more your good cholesterol comes up, the better for you. It's very protective from heart attacks and strokes. The bad cholesterol, you want to get down as much as possible. Below 100, ideal is below 70. If you can get it below 70, that's ideal. If you can get your bad cholesterol below 70 by our guidelines, nobody will give you a cholesterol medication because you're perfect, right? So it's important to get that bad cholesterol down. Well, how can you get it down? By diet. Diet, eating the right sets of foods. So that's very, very important. The other thing is blood pressure. Anybody know what should blood pressure be usually? 120 over 80, perfect. Everybody has that magic number. What is the number one reason African Americans have heart failure in the United States? I'm sorry? But what, high blood pressure, I think somebody said it over there. High blood pressure, yeah, you'd think it's sugar diabetes. Hypertension is the number one reason why African Americans have heart failure in the United States. And hypertension and diabetes is the number one reason they end up on dialysis, right? So it's important to control that blood pressure. And how do we control it mostly? Salt. 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 The lady, the nurse that spoke before me, talked about how she went to a patient's house and found out that he was eating all this stuff that was bringing him into the hospital. So watching the amount of salt we have in our diet is very, very important. The American Heart Association encourages less than 1,500 milligrams of salt per day. That's half a teaspoon. And so that's salts that you add to the food plus the sodium that you're imbibing from the sodium label. So you need to read the labels. That's very, very important, right? And how about diabetes? Anybody know what hemoglobin A1C is? It's a measure of the average amount of your blood sugar in the last 3 months, right? What's normal? What do we want it to be? Less than 6.5. Yes, actually, ideally less than 6, right? Ideally less than 6. If it's between 6 and 6.5 is what we consider pre-diabetes. Once you get to 6 and above, that's 6.5 and above, that's considered diabetes. So we want it to be ideally less than 6, but at the very worst, less than 6.5. And that's watching our diet, right? High starch diet, right? So all that stuff like rice and potatoes and macaroni and pasta and bread, all of those, we gotta watch them. Try to go from white starch to brown starch, right? Whole wheat bread, whole grain bread, whole wheat pasta, whole grain pasta, brown rice. Those are the kinds of meals that we want to engage in and the kinds of meals that we want to eat, right? Things like family history we can't help, right? If you have it in your family, you have it in your family, you just gotta work harder than the rest of the population. Things like our age we can't help, right? The older you get, the more your risk for having heart attacks and stroke. The other thing, of course, is let's quit smoking. For whichever of us is smoking, that's very, very important. There are many ways to quit. There are many help websites. There are many, you can call, phone calls and things, but it's important to quit smoking. And then exercise, very, very important. So watching our diet, exercising, and just remembering that it can happen to any of us, but the ball is in our court to do as much as we can to improve our health. And then we leave the rest to God, right? So, thank you.